Hello, I'm Marcus Boston, and I'm a medical malpractice attorney practicing law here in the state of Maryland. And I would like to talk with you today quickly about a conversation that I had with a colleague on a social media site. And this question or this conversation that I was having is really important, and that's why I decided today that I should go ahead and shoot a video. I've kind of talked about this in the past, but you know, sometimes you have to just keep saying stuff so people can have a really good understanding of things. Well, this conversation started with a case that happened outside of Maryland, and my colleague and I, we were discussing this particular case. And what happened in this case was a teenage girl went to an emergency department complaining of back pain, and that teenage girl and her parents were asking the doctor, would the doctor go ahead and do an MRI? Well, the doctors decided that an MRI in this particular situation was not the way to go based on the young girl's complaints. Well, we're going to fast forward in the time about 3 months, and 3 months later, she's back. She's having really bad pains, and an MRI is done at this particular time. And at this time, there is a tumor found, and that tumor eventually leads to her having to have one of her legs amputated. And the discussion that we were having, something really came up really important in this situation, is that sometimes individuals will think that just because a bad result happened, that is automatically medical malpractice. And it's just not the case. In this particular case that I'm talking about, this case went on and it went to trial, it went to a jury, and a jury did determine that the doctors in this case did fall below the standard, causing this young lady's injury. But the purpose of this video today is to help you understand this process, that unless you, in Maryland, that unless you have another medical expert that will say and that will conclude that based on the records and based on the information and history of the patient, that based on all of this analysis, the treating doctor fell below the standard, causing the injury or the harm. If that's not there, then you're not going to be successful in a medical malpractice case. So that can mean essentially that legally you can have a bad result, and that may not be medical malpractice in the state of Maryland. So why have I taken the time today to talk with you about this? Because I'm trying to help you understand this process. I'm trying to give you insight into the analysis that has to take place anytime you contact an attorney as to whether you are the victim of medical malpractice. I'm trying to let you understand or let you see that there's a lot that has to take place in these types of cases. If you have more questions and concerns about your situation, you're watching this video right now, you're wondering, are you the victim of medical malpractice? Is there something that you can do? This is what I invite you to do. And remember, it costs you absolutely nothing to take this action. And that is pick up the phone and give me a call. I could be reached at 301-850-4832. Or if you prefer, send me an email to medicalinjury@bostonlawllc.com. I answer Maryland medical malpractice questions like yours all the time, and I'll be glad to take some time and listen to your story. All right, guys, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the medical malpractice attorneys here at Boston Law Group, LLC, and we will see you next time. Guys, take care and enjoy the rest of your day.